Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey, welcome back to Between the Sheets. We have an interesting topic for you today about fertility and the effects on your intimacy with your partner. And I have an amazing guest with me today, Ashley Holmes. She is a holistic fertility coach, yoga, and meditation teacher, and she's an advocate for mind-body wellness. She has a nurturing approach, and she empowers women on their fertility journey to overcome mental barriers, embrace self-love, and cultivate unwavering confidence. Ashley integrates Ayurvedic principles, chakra balancing, and restorative practices to support optimal health and natural conception. As a mother of three, including twins, Ashley's personal experiences inspire her mission to guide others in transforming their mindset, reducing stress, and reclaiming their inner power. She is a sought-after speaker, podcast guest, and writer passionate about holistic healing and resilience. So welcome, Ashley.
Thank you. I'm excited to be here.
Yeah, I'm excited to have you too. Fertility is such an interesting topic. Very fortunately for me, I was very fertile. I had my kids in my early 20s. And so that's not something that I have had issues with, but I have friends that have had issues with infertility, miscarriages, things like that. And so from the outside, I've seen how it can affect them, but I'm really interested in digging into this with you and how it affects individuals and couples and their life together.
Definitely. It definitely has a big impact and can take a big toll, not only on yourself personally, but on your relationship. And so you want to be able to keep that relationship healthy and strong as you're going through this. And it can become really challenging as months can turn into years, and there can be a lot of heartache and disappointment along the way.
Yeah, for sure. I'm sure. So, where is your role in this? Where do you come into play with your clients?
Women often come to me when they are very frustrated and looking for what traditional medical intervention hasn't been able to offer them. They're looking for more. They feel like they deserve more and they're looking for more answers and more of a holistic approach because if you've been to a clinic and you've used fertility drugs and you're aware that there are side effects and you probably don't feel like yourself as you're going through this process. So it's really a place to create a fertile foundation so that you have this to move forward with and to heal what you've been through already, because I don't think oftentimes people realize the impact that this has had on them as they've gone through it, because they're in it and it's so hard to see when you're in it the stress that you're under and how this is really just weighing so heavily on your shoulders.
Yeah, absolutely. Absolutely. So, when patients come to you, clients come to you, kind of how do you start that discussion with them and kind of delve into, do you start with like how they got there, where they're at in their journey, where they're going? Like, what's your kind of take on that?
My take is one-to-one and individualized to that person and what is going to be most supportive for them in the moment to help them navigate this, because someone who has had a miscarriage or someone who has never had, a positive pregnancy test, those are two different spaces and places to
Mm.
be in, as well as people come to me with secondary infertility, which is often not talked about often. And so I truly believe it's important to meet people where they're at and to move from there and to look at the aspects of their life that they're really struggling with. And oftentimes it's the mental effects that this is taking on them. They don't have mental clarity. They just feel like they're in a fog and they're just doing all of the things because they need to do all of the things, yet they're not present and they're not in their body because they're so stressed out. And this is really impacting their health and well being because they've been doing and trying it for so long.
Yeah, yeah, for sure. And so, how do you kind of help them connect with their partner and stay in it and enjoying each other and it not becoming a chore or a task that you check off on the right day?
Yes, because I can absolutely attest to that's what it becomes. It doesn't become the way you envision it. It becomes more like a science experiment. And so it really can start to lose its appeal, you know? That is just another thing. And so it's so important for my clients to be embodied, to understand their bodies, to listen to their bodies, to trust their bodies, to really come back to their own sense of wholeness because sometimes they fill out their form and say, like, I'm broken, fix me. And so we have to look at and discuss the conversation and the narrative that is going on and the inner dialogue that nobody else in the world knows is happening for them. But
Right.
we really want to take a look at that and really address what is showing up for them. And sometimes it's in the things that aren't said. Sometimes it's in healing sessions where things come through more strongly. And, you know, clients have been suppressing tears. And I'm like, let your tears flow. I can
Yeah.
tell that you're like physically holding on to this pain, to this sorrow. And it's important to, you know, allow yourself to feel and move through all the emotions as you're going through
Yeah.
them and not to energetically hold on to them.
Yeah, I can imagine that that would be really tough and just kind of it's such a mind block too to just to enjoy everything. So what are some things that do you have them go out on dates? Do you have them, how do you get them out of that funk of just focusing on the fertility part?
I think it's gotta start with you. You have to be connected to you in order to be connected to anybody and anything around you. So it all starts within and to move from there. But also I've had clients, you know, teach their partners, you know, stress relieving techniques that I've taught them and things like that.
Mhm.
When their partners come home from work and is stressed out, we'll do this, try this, you know, and then they're seeing the effects and benefits as well. So it's kind of like you becoming your own teacher and
Yeah,
you like passing on that knowledge to help both of you to have a stronger relationship and to navigate, you know, the obstacles that are coming your way because there will always be obstacles, but you
sure.
know, how are we addressing them and facing them?
Yeah, yeah, no, that's awesome. And so, you really focus on the women and then they go home and work with their partner, right? You're not doing couples counseling or anything like that,
No,
correct?
I'm not.
Okay, yeah, that's what I was thinking. So, are there specific things that really help women? 'Cause I know we're in our head a lot. So we can't always compartmentalize to kind of enjoy the moment and whatever. What are some, relaxation techniques and things that you teach these women to kind of work through?
A big part of it is understanding your emotions and where those
Mm,
emotions are housed within your organs, within your body, so that you can know that if you're feeling angry, then I could choose this yoga practice. This is going to be supportive for me in the moment to
mhm.
move through that and to let it go, right? Because we don't want to hold on to things, but we also don't want to suppress them either because then we haven't dealt with them. And so I love teaching my clients yoga and meditations
Mhm.
to really bring to the surface what is in their subconscious mind because only when we bring light to it do we see what is there and awareness to it and then we can shift things and we can change things and we can, you know, create new neural pathways in our mind, but we have to first realize and become aware of the thoughts that are running day in and day out that aren't serving us and to begin to choose a different path and to really, you know, plant seeds that we want to grow in our mind and to stop watering the weeds because often we're just, you know, we've seen so much disappointment and we've had so many high hopes and so many expectations that haven't been met and then, you know, we're carrying that into the next month. And so really just
Yeah.
giving that space to heal, to clear, to let things go and to start anew.
Yeah, that's beautiful. Are there particular yoga practices or poses that help with fertility?
A lot of the yoga that I offer is yin yoga
Mhm.
primarily, which is similar to going to acupuncture
Okay.
for um it has the same type of results because it's you applying acupressure through the poses to your body. So
Oh, interesting.
it's
Okay.
similar, But you can do this for yourself from the comfort of your own home, and you don't need to go anywhere. And it's not another to do or an appointment. You
Mhm.
can kind of fit this into your life. So that is very beneficial also to get into the issues in our tissues because we all have issues in our tissues.
Yeah.
So,
Yeah.
and to come into rest and digest mode and out of fight or flight mode. So, we're working with our nervous system with yin yoga and restorative yoga to really allow the body to stop doing, to allow it to be, and to come into that receptive, open state. Because
Mhm.
oftentimes we're doing all the things, and yet our energy is blocking us because we're not in a state of flow. We're just moving unconsciously through our day, trying to make this happen and to sort of force this into being. And so there's just a different energy and dynamic to bring to
Mhm.
it. And so those practices are really, really powerful and what
Mhm.
most of my clients need the most because they are already doing so much. And so it's just that mindset of we need to create balance within our
Mhm.
life, within our day, within our mind, body, and spirit, and to know that what we do to one
Mhm.
affects the other. So often, the easiest thing to do for most of us is to work with the body because that's easier for us to grasp and for us to start there. And then that affects our mind, it affects our spirit, but then we can sort of move into other practices. But to begin there is often very beneficial for most of us. We can't
Mhm.
sort of, dive straight into the mindset right at the get-go.
Yeah, no, I think that's beautiful. And, I'm just sitting here listening to you talking about this, and I think that this could be, not just for fertility, but it could be applied for other issues that you're having too, just really getting into that mindfulness space and letting your body kind of work through things. And, I work with people who have different sexual dysfunctions, couples issues, individual issues, things like that. I'm just feeling like this could be applied to, I know your specialty is fertility, but I feel like this concept could be applied in many areas of life in relationship to sexuality.
Definitely. So the work that I'm doing is basically from the root chakra, and I'm focusing primarily on the sacral chakra because that's where reproductive organs are housed. So if we've had trauma to these areas
Mm,
in our lives, that is going to
sure.
affect us. And if we have, PCOS or endometriosis or these other symptoms that can be
Mhm.
present while we're trying to conceive, then we need to address them and work with them and, bring that harmony, that balance, that alignment back into our body because oftentimes that hasn't been the case. But
Mhm.
always at the base of it, and from a nervous system perspective, is that the body needs to feel safe and secure
Mhm.
from the beginning, and that's really your root. And for most people, they think, well, of course I am, but you can be saying that, but your nervous system may not be feeling that, and there can be a misalignment there. And therefore, that can be a part of the struggle because maybe for job security reasons or whatever the case may be, you may not actually feel safe and secure in your body to bring a child into this present moment.
Oh, that's really interesting. I've never really thought of it as that feeling of safety and security, and that can affect your body's ability to get pregnant, to carry that baby.
Yeah,
That's so
definitely, because
fascinating.
we can be thinking, you know, whether, there's a saber-toothed tiger behind us or not, we can
Right.
be feeling that way. And this journey can make us feel that way, right? Like this feeling of I'm not safe because this isn't happening for me. And so it can be sort of, this double-edged sword of not working in the best and highest version of
Yeah.
yourself.
Yeah. No, I think it's great. Being in medicine, I hear a lot of things from the medical side perspective of fertility. In my clinic, because we're urology, we may help with, vasectomy reversals or sperm extraction. We don't do a whole lot for the female fertility part of it because that's the OBGYNs. But it is, I come at it from such a medical perspective that it's nice to hear more of the holistic side and other things that, my patients can be working with either themselves or together to kind of combat it from a different perspective. obviously, if they've had a vasectomy, no amount of yoga is gonna reverse that. We're gonna
Yes.
need my guys to get that done. But I think that this is just it's great for me to hear something other than here's a pill, here's a medicine, here's a surgery, here's something. I feel like this gives them some ownership and some ability to feel in
Yes.
control, which I think is
That
such
is
an issue with infertility. You feel so out of control, I can imagine.
Yes, absolutely. And what I offer in my program is centered around what you can control, and
Yeah.
shifting that locus of control from external to internal. So we address all the things that you do have control over and that you can influence and
Mm.
impact. And there is a degree of surrender and letting go of the rest because you can do so much. And then you have to be able to surrender and let go. And from my own experience, because I have twins who I obviously conceive using a fertility clinic, but to
Mhm.
also know that, that also like the mindset and what went alongside of that at that point in time over a decade ago was a high risk pregnancy
Yeah.
and an emergency C-section, a whole harder postpartum period versus when I embodied all of this ancient wisdom and this energy medicine that just is so potent and powerful that we can all
Mhm.
tap into. I was able to conceive naturally and have my water break, go hiking, have a VBAC, and be back
Yeah.
at Baby and Me Yoga 10 days later. So I
Wow.
was very empowered in what my body was truly capable of. And so
Mhm.
I think that oftentimes we don't have that awareness of what we can truly do because I was deemed geriatric and I was like, you can say that, but I'm not embodying that.
Yeah.
I feel great.
Yeah. No, that's fantastic. It's interesting when you say that you kind of do all this, like all the way through the labor and delivery part of it. When I had my daughter, I never dilated past 3 centimeters. I was on Pitocin, I was being induced, we broke my water, all the things. And I just couldn't dilate. And so we did a C-section with her. And it wasn't an emergency because, we had time. She was doing okay, but it was just not progressing. And so I felt like a failure. I never dilated past 3 with my daughter. And so when I went to have my son, we scheduled the C-section, and he had a double nuchal cord. So his umbilical cord was wrapped around his neck twice. And so had I tried to deliver him, could have been an emergency situation, could have been bad. So at that point, I started to feel better about the fact that my body never dilated the first time because this time it worked out. But I remember that feeling of being such a failure as a mom. And then, of course, it was my first one. So breastfeeding was terrible and like all the things. And I think had I had somebody pull me aside and say, like, let's work through that. Let's get, that, here's some mindfulness and things. I don't remember learning about mindfulness until the last few years. I wish I had had someone that could have taught me that.
Definitely. I think one, I totally agree and resonate with not giving myself grace for the
Mhm.
way things went the first time around. Like I only had enough milk for one and a half of my babies. And
Yeah.
so we had to supplement and just feeling like I wasn't measuring up in so
Hmm.
many ways. And I think, my goodness, I should have been a lot more loving and kind to myself at that time in my
Yeah.
life. And so I think women and new moms need to be given so much grace and told what a great
Hmm.
job that they're doing. And it shouldn't just all be about the baby. Like, their body is healing and doing so many amazing things too, and has
Yeah.
done so many things to bring it into this world. So
Yeah.
that really is so important. And then on the flip side of that, when I was actually in tune and in touch with my baby with my body, it was so important being in labor to know how to breathe and to remember
Yeah.
how to breathe and to actually bring that baby into being and to know how important, our breath is, and it connects the mind and the body, and that is your anchor. And so to really just keep coming back to that in moments of stress, in moments that are really, really trying, because that is always your anchor and it's always
Mhm.
available to you. And yet it isn't always utilized to its full capacity.
Yeah, absolutely. Yeah, no, it's definitely something I've been learning about and taking into my own life and practice, but also passing on to my patients, breathing through certain things, visualizing things, taking the negative talk out, manifesting, all of those things, I think is applicable to so many areas of our lives, but certainly fertility and sexuality and that intimate connection with our partner, and ourselves, to get that going.
Definitely. So important.
Yeah, for sure. So, talk to me about your women who, come to you and they're fully into the fertility. They're doing the shots, they're doing the appointments, they've got all this stuff going on, and it still just isn't working for them. Like, how do you get them to grasp onto the mindfulness and the other side of the non-medical side of fertility?
I think by the time women come to me, they are open to that because they realize that, you know, this hasn't been working and this hasn't been favorable for
Hmm.
them so far. And so one of my clients in particular came to me and never wanted to step foot in a clinic again.
Yeah.
Was,
Yeah. Done.
yet I to see the space that she came to and that she moved through, she still had 2 frozen embryos,
Hmm.
and so and is going for a transfer this month, and so
Yay.
I'm covered in goosebumps, but for her to be able to be back in that space and place of being willing and able to go through and to try again, it's
Hmm.
a testament to the resilience and strength that we have and what we're willing to do and go through in order to have a child. And so I think, you know, we can't rush this process.
Hmm.
And so I think it's beautiful that she stopped, she paused, she took the time to not just keep going. She didn't have the
Yeah.
capacity to keep going, to keep trying. And
Yeah.
so to reset and to really just honor and nurture her body and nourish her body and then go back and then be in that state and place to try again, I think is so important because you can medicate all you want and you can do all of the things, but if you're not in a good place
Hmm.
mentally, emotionally, spiritually, financially, with your partner, those things matter just as much.
Yeah. And they can really affect everything. I know I have patients who come in for various issues. For me, a lot of the guys have ED or whatever, and it has nothing to do with a medical issue. And it's so much, like you said, what's going on financially at work with your partner, with all of these things. And if I can get them to grasp that and go to see a sex therapist or, working out at the gym to relieve some stress, things like that, it's amazing how much the body can heal itself.
Yes, it truly is amazing what the body is capable of doing when we allow it to do so. But
Mhm.
often we're inhibiting it, and often these are unconscious ways that we are inhibiting, the natural healing process. But the body is designed and wants to always be healing and in a state
Mhm.
of healing. And I think that's something that we're not often taught. I went to the clinic thinking if they can't help me, then there's no other possibilities for me,
Sure.
which is really a sad state and place to be in, I feel
Yeah.
like, because you're absolutely outsourcing all of your power and all of your possibilities to outside of you and thinking that there is no hope if they can't help. And
Yeah.
so they have their part, and it's not one or the other. It can be both ends, but I think the most important thing to tune into is how you feel as you're going through this process because
Mhm.
if it's draining you and it's depleting you, then that's not this energetic space that you want to be in to
Yeah.
bring life into the world.
Yeah. Do you find yourself working with or getting referrals from certain clinics that the medical professionals have understood that this comes into play? Or do you find that women are just kind of completely tapped out and looking for any type of resource? Like, how are people finding you?
Most people are finding me honestly through Google.
Yeah.
They are Googling what else. And a lot of people, I live in Canada, they're coming to me because they want to work with a
Yeah.
Canadian. And so there's just something about that. And
Yeah.
I feel like also in Canada, there's often one clinic per
Mm,
province that
okay.
is just not very accessible for a lot of people to travel, to have time off work,
Mm-hmm.
like all of the things. And yet there's so much we can be doing for ourselves
Sure.
at home and to really improve our health and well-being before we ever even step foot in a clinic. And I think it's so
Mm-hmm.
important to speak to that, because if I would have known all of these things,
Yeah.
over a decade ago, but then on the flip side, that was my path and it was meant to be, because I wouldn't have the life that I have now. So I think there needs to be some
Right.
acceptance too of we are exactly where we're meant to be in the moment
Yeah.
and nothing is going to miss us, and to just trust in our journey and to trust in our body and trust in ourselves.
Yeah, I mean, I agree. You don't know everything from the start, and you can learn and grow as you go. And certainly, things that we learn along the way do change how we see things and how we look at our problems as maybe not so much problems, but things that areas of our lives that we can improve on and change. And you brought up a really good point about not necessarily being able to get access to the care that you need. Do you provide online classes or counseling or anything? Are you local only? How do you do that?
Everything I offer is online, so I can
Awesome.
work with anybody anywhere. And so I feel like that's really important
Yeah.
also to be able to fit this into your lifestyle and for this to work for you, because most
Hmm.
people don't want another to do, but
Yeah.
you have available access, and I only give things
Hmm.
out in sort of bite-sized pieces because I don't
Yes.
want to overwhelm my clients because they already have enough. But, a weekly yoga class and a meditation that goes alongside of it,
Yeah.
and then, the nourishment pieces alongside of it. These little things, which aren't really little when you
Yeah.
add them all up, because as soon as my clients start to implement them, they begin to feel astronomically better. And
Mm.
so, the proof is in the pudding, and it's just putting these things into practice and being conscious and aware and making those small shifts and changes.
Yeah. No.
It's not everything out the window, because we all know that that doesn't lead
Right.
to lasting change, right?
Right.
We need to take small shifts and changes and keep working with those and habit stack and look at our daily routines and
Yeah.
look at ways that we could incorporate mindfulness and
Hmm.
presence into our daily lives, and to notice when we're overwhelmed and stressed, and
Hmm.
to pause and to take that conscious breath
Yeah.
instead of just pushing through the rest of the day.
Yeah, absolutely. Absolutely. I love that. Do you have particular, like, do you teach the yoga classes and then you send them out, or do you have other teachers that you utilize?
No, everything I offer to my clients is, emailed to them. Oftentimes it's curated specifically to them for
Okay.
what I know that they're going through in the moment,
Yeah.
whether it's the holidays and they're struggling and finding it really hard, if they've lost a baby or
Hmm.
they thought that they were going to have a baby in the new year, it can be a really challenging time.
Yeah.
And so it's really important to honor the grief that goes
Hmm.
alongside of it. And so I was trained locally by a former monk, and so
Mm.
I really have these teachings and this ancient wisdom. And I have a guru still in India that I'm still learning from, because I believe in,
Yeah.
always being a student of life and knowing that I've never sort of arrived and
Hmm.
that there's more available to me. And I always want to be evolving and growing and learning.
Yeah. Oh, I agree. I think it's wonderful. And it's one of the things I like about this podcast too, is I get to learn from so many other wonderful providers that I wouldn't necessarily reach out to in my daily life or learn from in my daily life. And so it's been really interesting to make these connections and to learn other aspects of sexuality and sexual medicine and sexual health through doing this. So it's been really a great journey for me as well. So I can appreciate that from what you've gone through also. That's really cool. Do you have any upcoming things that you're getting excited about or that you're going to be adding into your what you offer?
I do have an exciting offering coming in 2025. So it is a 1 year circle journey
Hmm.
of remember your wholeness. So we meet once a month for 3 hours, and if you haven't heard of the book, The Sophia Codes, if
Okay.
anything I've said resonates with you, it is one of my favorite books, and I am doing the restorative yoga for it,
Mhm.
and my friend Taryn has been doing these circles. She's in South Africa for many, many years. And so we are doing this together
Mm.
as just this remembrance and, a sacred circle of women to just come together. And what transpires from that is just that energetic feeling of being held, supported, guided, and receiving what you need. And also the invitation and the remembrance to slow down,
Mm.
because I think in our culture, it's really, really important to remember that we can slow down, we can and need to take time for
Yeah.
ourselves, and we can't, especially as women, move through all the phases of our cycle at the same speed and the same pace
Yes.
month in and month out because we're not designed to. So
Mhm.
taking that time to really honor our bodies.
Yeah. Oh, I love that. That's so important. And I think that that would be a really great class for a lot of people. And obviously, you said everything you do is online, so people can join you no matter where they are. So that's very exciting. And we can put links to all of your things in the show notes today so that everyone has access to you. I just think this is such a great discussion today. I really appreciate you being on here. You've certainly opened my eyes to different ways of looking at fertility and working through that with friends, colleagues, and patients of my own. And so I hope that people who are going through this were able to take some pearls of wisdom from you as well.
Thank you so much for having this space and for
Yeah.
having this conversation because I think it's so important and to keep that connection and that bond strong as you move through your fertility journey.
Yeah, absolutely.
Especially if
Yeah.
I think as women, if the issue lies with you, then oftentimes, as was the case with me, we
Hmm.
can feel heavily burdened because, if
Hmm.
this doesn't happen, then we feel like it's all our fault.
Yeah.
And then there's that extra weight and stress and pressure of
Hmm.
trying to make this happen.
Yeah. Yeah, I agree. I agree. Do you have any really exciting stories that you could share of a successful patient or two?
Yeah, definitely. I'm very, very happy to, receive announcements of I'm pregnant and to see that, you know, one of my first clients, it was, I now see pictures of like a 3-year-old and it's like, wow,
Yeah.
like time moves quickly. And so it's really exciting to just to see that and to know that I've positively impacted so many lives. And also to know that whether there was a baby or not, no one I have worked with has been, not positively impact.
Mm.
They've all, 100% have this has been worthwhile, has been worth
Yeah.
the investment, that investment in self and
Yeah.
sort of the peace that comes alongside of it. Because if you don't have peace with where you're
Hmm.
at and what you've been through and what's happened, then, you will continue to struggle and suffer. And
Yeah.
so just to create a space for that as well, for wherever that person is at and whatever
Yeah.
their journey is.
Yeah, that's so great. Yep. And I think it's great because it gives couples, women that are going through this some hope and another avenue that gives them a little bit more control over the journey as well. I love that.
Yes,
Yes.
absolutely.
Awesome. Well, Ashley, thank you so much for coming on here with us today and talking about this delicate subject. And hopefully, we have listeners that have taken away from this and added to their journeys as well. So, thanks so much.
Thank you, Stephanie. It's been a pleasure.
Yes. All right. Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday. Because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.